Hi guys, Amanda Brooks here. How are you today? I guess I never really realized how big my hair is till I come on here and it takes up the entire screen. Anyway, that's a side note. Today I wanted to talk about two things. When I was working in the emergency department yesterday, these things seemed pretty prevalent. So the first thing is pain control. Narcotics, they've kind of taken over our world, or actually our nation, and people, they want narcotics for everything, even sometimes a hangnail. It's ridiculous. So one of my colleagues, he's super smart, smarter than me, super nice guy. He shared with me a study. So Chuck, that's you if you're watching. But he shared a study with me looking specifically at treating patients' pain with a combination of Tylenol, 650 milligrams, and ibuprofen, 400 milligrams. So taking ibuprofen and Tylenol together is as effective, if not more effective, than taking certain narcotics like oxycodone and hydrocodone. So we have to remember that narcotics were created for a purpose. There's definitely a time and place to use them, but if you have a hangnail or a simple ache or pain, or if you are suffering from influenza, which I'm going to talk about next, this combination of Tylenol and ibuprofen is super effective, has no addiction potential, and gives you proper pain control. Now, if you remember a recent video that I just posted about Tylenol toxicity and ibuprofen being metabolized through kidneys, obviously go back and watch that. So I'm not talking about becoming toxic with these drugs, but using them to treat pain effectively. And I'm most certainly not saying that narcotics should never be used. I'm just talking about run-of-the-mill pain. So anyway, it was an interesting study. Good morning, Mike, Brooke, Tammy. Hey guys. Anyway, I thought that that would be interesting to share and for you guys to share with other people that are suffering from discomfort. A lot of times patients come into the department and they think that Tylenol, ibuprofen doesn't work, but you know, we don't know it doesn't work till we try it, right? So that's the first thing. The second thing I wanted to talk about today was influenza, because I'm seeing, we in the emergency departments locally, we're seeing a lot of influenza A specifically. So again, I feel like I need to stick in all these disclaimers, but I'm not saying that no one needs to seek medical attention for influenza. Now, the extremes of age, you know, the really, really young, the really, really old, the people with comorbidities like COPD, heart disease, yeah, they definitely get super sick with influenza, and they need to seek medical attention. But when we think about flu, we think about symptoms like headaches, cough, body aches, fevers. You feel lousy. So I feel like people are feeling really lousy. They're used to feeling really, really well, and they want to come into the emergency department, have me wave my magic wand that I don't have and make them feel better. Now, the treatment for influenza, it's actually just supportive care. So if you're suffering from a fever, and remember, fever is our body's way of fighting off infection, so sometimes allowing a fever is a good thing because it helps to fight infection, but it really also makes you feel run down, crummy, gives body aches. So treating fever with Tylenol, ibuprofen, that would be fine. Also remembering to stay hydrated. So dehydration is a problem. So if you're nauseated, ginger essential oil can always help. Your primary doctor can prescribe you an anti-nausea medicine. That's helpful. Also, another thing that we see with influenza is headache. So I've talked about this before, but peppermint oil has been studied in a study specifically against Tylenol and proven to be just as effective for treating headaches. So rubbing a drop to your temples, the parietal area, and then maybe cupping your hands over your nose and mouth and doing deep inhalations works really well for headaches. Another thing that we see, we're seeing a lot of diarrhea. So remember, your body, it's an amazing thing, and it has a way of healing itself. Diarrhea typically happens when we have a toxin. We're trying to get rid of it. So please, if you have loose stools, don't take Imodium right out of the gate. I know that we want to feel better. We want to like stop having the loose stool, but remember, let the body kind of do its thing. Let it run its course. Sore throats. Sore throats are like probably the most annoying thing because there's really not a great way to treat them. Something that I've found that's pretty effective is remembering to use a therapeutic grade essential oil, but making a gargle. So using oregano. that's a hot oil, so it's not going to taste good, you guys. It's going to kind of burn going down. But mixing like 1 drop of oregano, 1 drop of lemon kind of neutralizes the potency and the smell. Gargling it and swallowing it, and doing this as needed, so you're able to repeat this. That makes things feel a little bit better, as well as applying lavender, 1 drop topically to the throat externally. And again, just keep repeating. Coughing is so annoying as well, but using a therapeutic grade essential oil topically to the chest, like peppermint, eucalyptus, melaleuca, and then remembering that the bottom of the feet, for all of the little people out there, are it's the most porous area in the body. So putting these oils on the bottom of the feet, so they're absorbed into the body much faster, and can help with that cough, as well as maybe even purchasing a diffuser. I saw some at Bed Bath & Beyond the other day, so they're pretty much everywhere. Amazon's where I buy everything because it comes right to my doorstep. But thinking about diffusing some essential oils. There's also a blend out there. It's called Protective Blend. They have studied this specifically against influenza. So because essential oils, if we remember, they're antimicrobial. That means they kill not only bacteria, but they kill viruses. So antibiotics only work on bacteria, which is what we use in like traditional medicine, antibiotics. Essential oils are not only antibacterial, but they're antiviral. So essential oils can actually, inhibit the growth of viruses as well as degrade them. So in modern medicine, there are a certain class of individuals that we do use an antiviral for influenza, but that is only when you catch the process in its very early stages, like 24 to 72 hours. It doesn't eradicate the disease, it just shortens its course. Not so sure how effective it is. I've read studies that it's really not that effective at all. So anyway, coming back kind of all over the place. Good morning, Joey. Good morning, Eliza. Good morning, John. Enjoy. So all I'm talking about is things that we can do to prevent going into the emergency department. I know you don't feel well, but you also have to remember that when you go into the emergency department with influenza, you're subjecting other super sick people to your illness, and if they develop influenza, then bad news for them. So if you need a work note, if you are just having some symptoms that maybe you could try treating at home before coming in, if you're trying to determine whether you have influenza versus like a plain old cold or upper respiratory infection, it's nearly impossible. The only way that we can do that is if we swab you, like put a swab into your nose, tickle the back of your throat, it's super uncomfortable, and then we can tell you, but it doesn't really matter because treatment's the same, it's just a virus. So anyway, I'm hoping that you guys have found this somewhat helpful. Just supportive care, take care of yourself. Flu shot, not gonna go there, don't do it. But anyway, that's another video. So hope you guys are doing well. Hope you're staying warm. It's like a heat wave here today, comparatively in the Bangor, Maine area. But wishing you guys well and have a great day. Bye.